Thank you everyone for joining into the webinar. I can see we're still getting more participants. We're at the top of the hour and I'd like us to start. So I will be one of the moderators for the session today, for the webinar today. My name is Ruth Mwendo from the World University Service of Canada, a strong advocate for childcare and issues childcare. I'll be taking you through the first 30 minutes of the webinar, and my very able colleague Munaweza Muleji will take over after the first 30 minutes. I'll begin by introducing this webinar and why it is critical that we have the conversations that we are going to have on this platform. So I believe that most of you know that the ECD network for Kenya has launched a childcare campaign where we're really amplifying our voices as a network, as supporters of the network, in our contexts and beyond regarding issues childcare. And this is really informed by the global as well as the local momentum that we have around childcare and the realization that every child, every baby born into this world has unlimited potential. However, the opportunity to set a foundation for children, we do not have a very long window to set the foundation and to set them up and to level them the playing field for children who are developing. And so we want to bring this awareness to all stakeholders, given that children really, we can do a lot of things in the first 1,000 days or the first 3 years of life. The science on ECD is very clear that there is so much happening within the brain of a child. And what science tells us is that there are around 1 million neurons being neural connections or pathways being developed every second in the brain of a child within the first 3 years of life. And if children have consistent positive experiences, regardless of where they're born, we are able to set them up for success and for better outcomes in their lives. The achievement gap as well is able to be closed within the first 5 years of a child's life. And the evidence around the different countries that have invested in childcare is very clear. Cuba, for example, has a very high human development index, despite the fact that it still is under low and middle income countries. And that's for the primary reason that this country has prioritized childcare from when children are in utero up to when they join pre-primary, thereby equalizing the opportunities for children and really setting them up for success. The business case is also very clear. For every dollar invested, it's estimated that about the return on investment is $7 to $12. And that's to the economy. To the workforce that works within the childcare economy, there's also a return to be reaped if this workforce is skilled, and there's a return to the GDP of any country. Women are also able to participate in work if childcare is provided. And to the larger economies, and the social good cannot be overemphasized. So we are very glad to be launching these discussions, and today we'll be hearing from different organizations that have been able to leverage different opportunities to pilot, to prove different concepts, and to really demonstrate that it is doable. It is possible to reverse certain risks or certain deficits that children may have had when growing up. We'll have 4 panelists in this discussion, but to begin with, I would like to introduce a board member who will be giving us welcome remarks. So today, we'll receive very brief remarks from Joyce Wesonga, who is a government relations specialist with EIDU or EIDU. She has been a strong advocate for the last 15 years on matters childcare. She has advocated and really seen the implementation of different interventions to do with childcare. So at this point, I will request Joyce Wesonga to give very brief remarks and to welcome the participants into the webinar. Thank you. Joyce, do we have you on the call?
Thank you. Thank you, Ruth. On behalf of ECD Network for Kenya Board of Directors, the ECD Network Secretariat, and the Child Dialogue Campaign TWG members, I'm delighted to welcome you to this webinar themed Universal Access to Quality Child Care and Child Protection Services for Children 0 to 5 years in Kenya. The ECD Network for Kenya is a national membership organization that was established in the year 2015 to bridge the coordination gap in the ECD initiatives across the country. Our primary mission is to ensure coordinated action amongst all ECD stakeholders in Kenya and to be the voice for children. We strive to foster a strong multi-sectoral collaboration to advance nurturing care for ECD. As a membership organization, we currently have 15 member organizations, 62 individual members, and 45 advocacy partners. I encourage those who have not yet joined the network to consider doing so today. ECDNet collaborates with the national line ministries and relevant county governments through the Council of Governors. Through our membership, we have extended our reach to 34 out of 47 counties. In our research efforts, we are undertaking two significant collaborative research projects. The first focus on ECD system measurement, guided by four thematic areas, that is ECD financing, policy, multi-sectoral coordination, and governance. We are collaborating with Mathematica in this research. The second project is a randomized control trial that is dubbed Msingi Bora, aimed at promoting responsive caregiving. We are collaborating with the University of South California and SWAP Kenya. In advocacy, ECDNEC is working with the Lake Region Economic Bloc to enhance multi-sectoral collaboration among ECD actors. These initiatives involve working with the first spouses, county commissioners, the county leadership from ECD-related departments, and CSO, that is both national and grassroots, to address issues affecting children. In collaboration with the African Early Childhood Network and other childcare stakeholders, ECDNEC launched a childcare dialogue campaign in June 2024, targeting children aged 0 to 5 years in Kenya. The campaign, themed Universal Access to Quality Childcare and Child Protection Services for Children 0 to 5 years in Kenya, runs from June to December 2024. The childcare campaign is also happening in 5 other African countries. The campaign aims to raise a nationwide awareness about the importance of quality and affordable childcare and to highlight the evidence and milestones in childcare in the country. The National Childcare Dialogue Campaign is guided by a technical working group and plans are currently underway to convene a National Childcare Dialogue event scheduled for November 14, 2024. We invite everyone to join us in amplifying the need for quality childcare and child protection services in Kenya. Regarding partnership and coordination, ECDNEC convenes national ECD conferences and webinars. We are currently planning the 6th National ECD Stakeholders Conference scheduled for 2025 in Garissa County. Additionally, we conduct quarterly webinar series that were initiated in the first quarter of 2024 and will run through 2025. The webinars serve as a platform for knowledge sharing and learning. This allows partners from both state and non-state sectors to showcase successful and innovative ECD programs and interventions, share evidence-based research findings, enhance network and collaboration among ECD stakeholders. ECDNEC has held 4 successful webinars. The first one focused on governance in ECD, the second centered on multi-sectoral coordination and collaboration in ECD, the third one focused on sustaining and scaling up change in ECD, and the fourth one focused on policy in ECD. Today, the ECD NEC is excited to invite you to this webinar to explore the childcare landscape in Kenya. Our speakers will discuss key topics, including strategies and success stories for promoting positive parenting, the childcare caregiver curriculum 3 aimed at professionalizing the childcare workforce and empowering the home-based childcare providers to ensure quality and protection in early childhood development. We look forward to fruitful discussions and insights that will advance the ECD agenda in Kenya. I urge all partners to join forces with ECD NEC in amplifying children's voices for holistic development. Thank you.
Thank you very much, Rachel. We'd like to transition into the presentations by the speakers who will be giving us perspectives into the childcare ecosystem. So the very first person to speak to us will be Mr. Lisel Mogaka, who's the director for the Directorate for Social Development. He has over 34 years of experience working in government in different sectors that are quite relevant to the discussion we're going to have today. And those thematic priorities cut across education, training, youth, gender, family promotion, as well as disability rehabilitation and community support. Welcome, Mr. Lisel. We look forward to your presentation. Thank you.
Okay, thank you. Thank you for welcoming me. My name is Lisel Mogaka. I'm the Director of Social Development from the State Department for Social Protection and Senior Citizen Affairs. The State Department for Social Protection and Senior Citizen Affairs is within the Ministry of Labor and Social Protection. And within that State Department, we have the Directorate of Social Development, the Directorate of Children's Services, the Directorate of Social Assistance, and the National Social Protection Secretariat. On issues to do with children, it's mainly dealt with in the Directorate of Children's Services, while the National Positive Parenting Program is within the Directorate of Social Development, where we have the Division of Family Promotion and Social Welfare Division. And that is where this program is domiciled. Allow me to give you an overview of the promoting positive parenting at a national level, providing strategies and success stories. From my presentation, as you can see, we have the preamble, which is the overview and rationale for the National Positive Parenting Program. We have the legal and policy context for the National Positive Parenting Program, the legal and policy context for the program, the status, update, and success stories, the National Positive Parenting Program implementation process, the lessons learned, and the recommendations. In Kenya, maybe I might ask a question, why have we developed the National Positive Parenting Program? What we can see is that Kenya as a country is committed to the family. You can see we have Chapter 4 in Article 45 of the Constitution, which recognizes family as the national and fundamental unit of society and the necessary basis of social order. It provides the government with the mandate to promote and protect the family unit. Then we go further to Article 53(1)(e) of the Constitution of Kenya, where a child has a constitutional right to parental care and protection, which includes equal responsibilities of the mother and father to provide for the child, whether they are married to each other or not. Then we have now the positive parenting in law. It should be in law. We have developed the National Policy on Family Promotion and Protection. With its major aim is to realize its vision of a happy and stable families for a strong society. This policy reinforces a positive cultural relevant role of men, women, youth, and children in safeguarding the well-being of their families. It also promotes the development and the implementation of national guidelines on parenting. promotes design and implementation of parenting education programs, promotes policies that favor harmonization between work and family, where we have to, as a family, we have to compare both family and work. Then we balance on how to live within that environment. We have the Children Act of 2022 in Section 2 and Part 3 on parental care and parental responsibility. We have the Children's Policy of 2010, which advocates and promotes programs on effective parenting, and then the provision of age-appropriate and gender-responsive information, life skills and materials at all levels of child development. I think that is what ECD is all about, to ensure that our children get the right information, our parents, our caregivers also get the right information. Kenya has national plans. We have the national blueprint, that is the Kenya Vision 2030. We look at the social pillar of Vision 2030 on improving the quality of life of families and communities. And then we have in 2019-2023, there was a survey that was done, which came out with the National Prevention and Response Plan on Violence Against Children. Parenting is part of family support and one of 6 strategic areas of the plan. And its strategic objective is to promote positive parenting practices and economic strengthening to reduce violence within the family. The main objective as an evidence-based gender transformative parenting intervention with the goal of supporting parents and caregivers to enhance the execution of their role as parents, specifically their parenting knowledge, attitudes, skills, beliefs, behaviors, and practice for the holistic development of children in Kenya. This program's main objective is on the premise that parents and caregivers, both men and women, play a critical role in children's health and well-being. They are expected to provide love, guidance, and support that children need to thrive in their life. The main strategic objectives for the National Positive Parenting Program, first is to support parents and caregivers to learn positive parenting techniques appropriate for all ages and capacities. That's from 0 to 5, and from also the age after 5, to create a secure, loving family environment in which children develop to their full potential, and also to support families to nurture respectful and equitable family relationships, and also support all family members to learn and apply practices which promote positive mental well-being. Parenting programs work best when active learning and adult learning approaches are used to build on the strengths of the parents and caregivers. People learn best when they are actively involved in their learning. This is experiential learning, which encourages adults to try things out. It's also participatory, which encourages participants to think for themselves, learn for their own experiences, share their own knowledge and experiences, ideas, learn from one another, work together to solve problems, and also take responsibility for their own learning. What is the vision and mission? Vision, mission, and purpose of the National Positive Parenting Program. The vision is loving, safe, and thriving families where children realize their full potential. The mission is to promote and protect families through innovative programs, strategies, and services for a strong society. And the main purpose is to support the government and partners to implement evidence-based, gender transformative, positive parenting programs in Kenya, where as an organization or as a partner, you also learn from here and also take up your responsibility for the purpose of bringing up a positive culture or positive parenting attitudes within our society. Now we look at the core principles, the positive parenting core principles. One, it is to promote the child's best interests. You know, as a child grows, that's from 0 to 5, we have to know how they should be brought up well. And in this case, we promote the child's best interest. We value child and family strengths within that context. Whatever we do, let it be family-centered. We take a rights-based approach. We promote gender equity, or the program is meant to promote gender equity, promote child participation, integrate the principle of togetherness, that's Ubuntu. You are because we are. We are the ones who should bring up the next generation. We work together. The core positive parenting behaviors by providing love and care. Mothers, fathers, and caregivers provide nurturing care and demonstrate love. When this happens, children feel loved, they feel supported, cared for. We allow them to build a sense of belonging, trust, and security. We also encourage children by giving regular and repeated positive feedback, spending quality time with children, taking an interest in the child's unique interests and character. And this foundation provides the opportunity for children to develop a strong sense of self, to build resilience during adversity, to develop trusting and equitable relationships in their adult lives, and give them the best chance to develop to their full potential as adults. The parenting through stages of development, we are aware psychologically from the age of 0 to 5. When parents and caregivers understand the basic principles of children's development, they can better respond to age and developmental stage-specific needs. You know what a child at 2 years needs and what an adolescent also needs in terms of psychosocial support and other support mechanisms. Using positive communication, the challenge we have as we grow up is developing or coming up with positive communication skills, expressing empathy and support, provide positive reinforcements, develop skills for open and respectful dialogue and shared decision-making within the homes and beyond, homes, schools, and even within the community. Modeling an equitable family, families critically reflect on gender roles in the households and share household tasks like caregiving and income generation responsibilities, which are shared between or amongst men, girls, women, and boys. We also need to consider mental health and resilience. We choose practices to support the well-being and mental health of all family members so that everyone in the family, that's women, men, girls, and children, boys and children, have time for relaxation and self-care. Supporting children develop a social and emotional learning. Here, parents and caregivers provide opportunities for social and emotional learning, which includes, we have emotional regulation within the families, problem-solving skills, building social skills that support children's self-confidence and resilience. And we also apply positive discipline. We apply appropriate, which is appropriate to developmental stage and cognitive ability of the child. In Kenya, you are aware, we don't have, in the education system, the form of discipline that was used in the years before the law was passed was not appropriate for bringing up children. We provide effective role models. As children learn by example, they look at their elders as role models. We have homes free of violence households so that we make them learn that it's not in order for them to practice violence. Responsive to children's unique needs, recognize their unique values, promote the inclusion of children in all family issues, responding to parents and caregivers unique needs, all parents and caregivers have a right to support the full parenting roles. In 2019, the Violence Against Children survey, which was carried out, the physical violence by parents, which we found that is common, affecting 29% of females and 38% of males. So if children witness such violence in the home, they are likely going to practice violence in the long run. So the National Positive Parenting Program is as a result of minimizing incidences of violence within the family environment. Some communities accept wife beating as a form of maybe their social behavior, which is not acceptable. It has negative impact and also increases domestic violence on children, and the intergenerational cycle of violence continues. So this program was meant to ensure that such practices are discouraged within the society. Why has the government of Kenya prioritized a gender transformative approach to parenting? It recognizes that gender norms and inequalities profoundly influence family dynamics and decision-making. It also aims to address power imbalances in families, promote positive and equitable caregiving practices, develop respective relationships, and joint decision-making within the family. It intentionally seeks to engage fathers and male caregivers, and it has been realized that the fathers and male caregivers are always left out. It's not that they are left out, they are not consciously conscious of their roles. So this brings them together to ensure that they participate in the bringing up of their children, ensuring that both fathers, mothers, and caregivers are emotionally connected with their children and spouses, and also ensure that both fathers, mothers, and caregivers take joint responsibility with their spouse for household workload, which includes joint responsibility for unpaid care work, child rearing, and paid work outside the home, aims to help men and women resolve conflicts in a peaceful way, and also reduce violence in the home, including discouraging violence. In the National Positive Parenting Program, we have an essential document that is a National Positive Parenting Program guidelines, which provide harmonized national guidance through key rules and principles for practitioners, National Positive Parenting Training Manual, which provides key modules of parenting education, which can be used directly by parents and caregivers, National Positive Parenting Training Manual Implementation Guide, which provides a step-by-step guide for facilitators to implement the National Positive Parenting Training Manual. We have also developed a 5-year strategic plan to guide in the implementation of the Positive Parenting Program. This roadmap captures target outputs and indicators, including the budget, both for short and medium term and long term, for this program to cover all the 6 thematic areas. On the legal, policy, and administrative framework, the delivery, we have collaboration, coordination, linkages, and networking, workforce planning, investment, capacity strengthening, and support, increase the workforce, enhance support, and retain community delivery agents. The monitoring, evaluation, learning, and reporting, the key outputs of this program. The outputs and outcomes incorporated into performance contracting, which is in the government's programming. The baseline survey conducted periodic monitoring reports for data-informed decision-making to guide the National Positive Parenting Program, and the key learning which was disseminated. We have created the data management in the community development management information system to include the National Positive Parenting module. Resource mobilization. The resource mobilization strategy and plan was developed, communication and branding strategy developed, costing model for national was also developed. We have also developed the standard operating procedures for smooth, efficient, and effective implementation of this program, which promotes access to available services provided by various agencies to parents, caregivers that receive positive parenting training. We have a draft social behavior change communication strategy, which will ensure coordination of messages to reach multiple levels of society. We have developed the online self-guided introductory to positive parenting modules, which provide an overview of the rationale for the National Positive Parenting Program, key positive parenting messages, and guide users to access their in-person training. This will also provide the parents and caregivers with opportunities to learn and build up new skills to feel more confident as parents and caregivers. This program is a journey, and each step in the journey picks up a new skill. We might not implement this program the same as from one community to others, because it should be adaptive but not cast in stone. It depends on how each community or society lives and how they care for their families. But what we want to inculcate is the positive approach to parenting. Information and techniques are built up over the session, starting with the most important, such as understanding the importance of how to show love, how to offer security to children, and how our family members, how to offer love to our family members. Each new session builds on the journey that has already been traveled. So the delivery components: universal positive parenting education groups, community mobilization and awareness raising, and service integration, mainstreaming positive parenting key messages in Kenyan society through mass media, TV, social media, use of sports, theater, music, other media influencers, e.g. use of champions integrated into existing multi-sectoral service delivery. For example, community health promoters, schools, places of worship, barasas. We have also lay volunteer counselors from the social development who assist their communities to address their social challenges. We also would like to have a more specialized setting for parents and caregivers in need of additional support. For example, disability inclusion, drug and substance abuse, child support, protection, and mental health support. The content and delivery approach: we have 15 sessions delivered for 2.5 hours once a week through positive parenting groups. Session 1 is introduction to positive parenting programs. 2, family relationships. 3, the role of the parent or caregiver in child development. 4, strong and secure attachments. 5, caring for yourself and caring for others. 6, positive communication. 7, positive play and preparing to learn. Values and positive discipline. 8, 9, positive male involvement in parenting. Creating peaceful homes together. 10, keeping children and families safe. 11, 12, positive and protective communities. 13, positive family health and nutrition. 14, family financial planning. And 15, graduation. The session approach and content as provided, there is welcome and home practice discussions. This is always the first activity of the session. Introduction of the topic, and each session introduces the core concept to be covered in the session. This is done through introduction of a proverb for reflection about the key messages and group discussions depending on the community. We have discussion, skills practice, applying the skills, self-care, well-being, key messages, and home practice. What we have achieved so far, and the successes, is that we pre-tested the National Positive Parenting Program training manual in 13 counties, that is Nairobi, Mombasa, Kisumu, Meru, Uasin Gishu, Kajiado, Nyamira, Siaya, Kakamega, Busia, West Pokot, Kilifi, Garissa, and Baringo. And then piloted in 2 counties, that is Kilifi and Garissa. The objective of the pilot was to test the implementation, including the competence of the delivery agents, delivery platforms, the dosage, that is the content, and supervision, among others. We have trained 3,766 parents on positive parenting skills during the pilot, and 54 self-help groups were registered. 38 of the groups were linked to Youth Enterprise Development Fund. 22 were linked to Women Enterprise Fund as part of the empowerment programs. 1,253 parents and caregivers were trained on the National Positive Parent Program launch. 52 officers, that is the social development officers and children officers, were trained as TOTs. We have also established the National Positive Parenting National Steering Committee and the National Positive Parenting Technical Advisory Committee. There is ongoing dissemination of the National Positive Parenting Program essential documents like the guidelines, manual implementation, the manuals, implementation guide, and the AIC materials. We have developed the 5-year roadmap to guide in the implementation of the positive parenting program. We have the online self-paced introductory modules, which I mentioned, which provide an overview of the rationale for the National Positive Parenting Program, key positive parenting messages, and guide users to access the in-person training. We have that matrix shows the National Positive Parenting implementation process. We have the monitoring and support. We have the community sensitization forums on positive parenting and providing positive parenting sessions, training to parents and caregivers. Facilitators train parents and caregivers, which takes 15 weeks. Training of the facilitators, the TOTs train lay volunteer counselors, child protection volunteers, community health promoters, beneficiary welfare committees. These are the ones who benefit from the cash transfers, which takes 5 days across the counties. We have training master trainers, two trainers per county, training supervisors, TOTs, training of trainers who are social development officers and children officers within 8 days. The lessons learned from this is that as we started, there is government leadership support, and also we have benchmarked with the Ugandan government, which also was taking an example from Kenya as the leading in the family promotion and protection policy, and also the National Positive Parenting Program. We have the multi-sectoral coordination, which is established at the county level structures. We use the evidence-based approach, capacity and system strengthening and inclusive which has developed a parenting model there is a program which is being sponsored by World Bank and UNICEF on nutrition, education for children, supportive supervision, sustainable resource mobilization, knowledge sharing, and benchmarking. Now, we look at the reflection, as you can see there. If you want 1 year of prosperity, you grow grain. If you want 10 years of prosperity, you grow trees. If you want 100 years of prosperity, you grow people. It's a Chinese proverb. And from our context is that particularly the issue of male involvement in parenting. From the African context, it's we don't want to leave anyone behind. For the benefit of bringing up the family, let all be involved. Thank you, and may God bless you. For any questions, you are welcome. Asanteni.
Thank you very much, Director, for that very excellent presentation discussing about positive parenting, the work that has been done at policy level, the interventions done as you grow the people. We would like now to move straight on to, if you have any questions, please note them down. We will have a chance for you to hear from the panelists their responses. But now we want to move on to the second session by Susan Mtana. Susan Mtana is the Associate Director of Policy and Partnerships at Kidogo Early Years. She has a mandate to pursue project finance and also to grow partnerships that Kidogo is using in her network. Is a focus on working with children. She has over 12 years experience with SMEs and has been with Kidogo for the past 6 years. She also oversees finance, HR, and operation functions. She will lead us in this discussion, talking about scaling quality and affordable childcare lessons from community-based models. So, Susan, the floor is yours. I'm sure that you will take us as briefly as possible through your slides so that the participants can benefit from your input.
Thank you so much. Thank you so much, and good afternoon, ladies and gentlemen, and thank you, ECD Network, for giving Kidogo this opportunity. So in Kidogo, we imagine a world where all children have the opportunity to reach their full potential. And we have a social franchising approach whereby we aim to improve access to quality and affordable childcare services in low-income communities. So currently our reach is, we are in 12 counties in Kenya, reaching 2,200 mamapreneurs, that is women in the childcare industry, and also reaching over 50,000 children daily. And the centers that we work with, we have a home-based center. There are women entrepreneurs who receive children in their home. We have school-based and also center-based center. So you find the problem that we are trying to solve as Kidogo Early Years is that working mothers in urban settlements lack quality and affordable childcare services. And even World Bank released a report in 2021 that globally over 350 million children lack access to quality and affordable childcare. So the options that these women have is either to lock the baby at home or take the child to an informal baby care center or pull an older sibling from school. Now the solution that Kidogo provides is that we go into communities and we map the mamapreneurs, and in this case with the help of the community health promoters. And mostly you find a majority of them, maybe they don't have any formal caregiving training, or we have some who maybe have basic ECD. And what we do is we do a baseline assessment using our internal quality standard assessment tool. And we take them through a 3-month quality improvement program, whereby we train them on have in-center mentorship and also an upfront training on topics relating to early childhood development and entrepreneurship. Because most of these mamapreneurs, when they begin the business, is either out of passion or out of need, whereby somebody's a stay-at-home mom, and the neighbors around, they don't have maybe nannies or need the childcare service. So mostly you find that it's not like somebody just woke up and said, I want to do this as a business. Mostly it's circumstantial. So what we do after the 3 months quality improvement program, we convert them to become our franchisees. And what you do is basic center renovation. We brand them and we just more of give them like a starter kit or a business in a box. And then we continue having franchising support or ongoing support with them. That is, we continue doing training, mentorship, and also coaching. And also from the franchising communities, like we have a community of practice whereby the mamapreneurs meet monthly to discuss their own affairs and the challenges. So our approach is aligned to the nurturing care framework, and it's focused on training them on ensuring that they have safe and stimulating environments. I want you to imagine in the low-income community is more of an iron sheet structure, maybe with hanging nails, which is not safe for children. And that is where parents pay maybe like $1 a day or less to leave their children. Sometimes there could be nutrition or there could be some nutritional program or not. So that's the kind of mostly the context that we deal with. So more of training them on how to ensure that environment is safe, and also training them to be nurturing caregivers. And the other bit is just to promote the play-based activities, and also training them on the basics of health, nutrition, and WASH, plus also like, for example, on nutrition issues, showing them like based on the locally available food, this is how you can come up with a balanced diet for a child, or even using the fruits in season if at all they're there. And also just to help the passing knowledge and capacity building through parental and community engagement. For example, recently we celebrated the World First Aid Day. So we celebrated that day by bringing the community together and training them on the basics of first aid. And also the other bit is the business and administration support. So in this case, somebody opened just a business. They don't separate the business income and the personal income. And also they don't have like a center management policy. So you find those are the things that we train them on. And allow us to just check to have a glimpse of the kind of centers that we transform. Maybe we go to the next slide. Yeah, so mostly those are the kind of centers that we find. So in that case now, when we bring the quality improvement program, it's just upscaling that center to ensure that it meets at least the minimum basics aligned to the nurturing care framework. And we have different lessons that we've learned over time while working in these communities. And the biggest one, or the biggest challenge that is there, is adequate nutrition is really wanting. Because you find when you have maybe like focus group discussions with the parents who bring children to the caregiver centers, they're like, sometimes they go out to look for manual labor or casual labor and they don't get anything. So at that point, they are forced to maybe just take the child to the daycare porridge, maybe to the daycare center, because they know maybe there is a porridge program supported by Kidogo, or maybe another, maybe just a Goodwill, and then just hoping for the best. So you find that adequate nutrition is a challenge. And at this point, we are looking at the caregiver. We want the mamapreneur to run a thriving business. Some of them have a feeding program, some of them don't have, and some parents bring food from home. Sometimes the food is not even age appropriate or age friendly to the child. So those are some of the challenges we've encountered in the communities. And I like to emphasize that the community health promoters really play a key role in terms of the role in primary healthcare when there is the growth promotion, whereby we check on the height, weight, the MWAC readings, just to see are the children really maybe on track, or maybe they're stunted, or are they wasting, and providing linkages to the nearest sub-county hospitals. And also one thing that is there is, let me just say, if we are to incorporate all the elements of the nurturing care framework to support the holistic development of the children, you find that it is expensive. Childcare, quality childcare is expensive, and there is a funding gap, because you find that if a parent pays 100 bob a day for that child to be taken care of for like the 12 hours in the center, chances are high, maybe for whatever they'll get might not be of quality. So we need private philanthropists, private organizations to come in and support, or even now, like looking at the bigger picture, just pulling in the government to just support that niche. And the other thing that we've encountered that cuts across the counties of operations is about the policy and regulatory environment. We acknowledge that there are existing regulations, policies, maybe some acts are still, how do you call it, some regulations are still under review, but you find like the issue is inclusion. Do they really reflect the environment in the low income communities? So when we talk about things like the minimum quality standards that are needed for a child care center, for example, you'll be told you need a certain kind of space for a certain number of children.
Susan? We expect to hear from Susan. I think she must be having a challenge with the network. Susan, like from Kidogo, is a certified public accountant. She's been focusing on the social franchising solution that Kidogo is running to establish childcare centers in low-income local communities. And she has been sharing the things that they've been doing.
Sorry.
Susan, you're back now. Thank you. Carry.
Yeah, sorry, I think my network cut off, sorry. Yeah,
Yeah,
so
so
I was talking about the previous slide, kindly. The previous slide? Yeah, thank you. So I was talking about the situation in the low-income communities. So in this case, when you talk about what are the regulations, do they support the home-based care or the childcare, the center-based childcare centers? If we come up with how do you call it? We tell them you need to have a fire extinguisher, you need to have maybe a title or a lease agreement. Some of these houses don't even have the registration. You want the facility to be in a certain way. So you find there is still a gap that needs to be addressed, at least to ensure inclusion. Another thing is more on the monitoring. Like, can we maybe embrace supportive supervision as opposed to, because mostly you find if there is a crackdown, it's more of we are closing the centers as opposed to let's work with the centers to ensure that they become better at what they do. The other thing that we've noted is about child protection issues and the referral linkages. Like, let me quote, one caregiver mentioned that mostly you find, to them, they find it easy if there's a child protection issue, they escalate it to the area chief. However, the Children's Services Department, they'll tell you, go to the nearest sub-county children's office. And these caregivers were saying like the Children's Services office is next to a police station. So the mamapreneur says, if there is this case, how do I even walk into a police station looking for a child care service office to report this? So there is that kind of fear that comes, which hinders the proper referral way. And also the caregivers' minimum qualifications. As I said, some of these caregivers, some of them maybe went through primary education, others high school, like very few have maybe even the ECD certificate. So more of there is also that gap. And the other bit is on licensing and fees. So beyond the registration, what are the annual licenses? If I'm to pay for the unified business permit as a caregiver, it has fire, I need the medical or the, how do you call, the public health and all that. So you find there are several licenses and maybe the fee needs to be at least good enough for them to ensure that they also run a thriving business. So let's look at the opportunities that exist. So the opportunities that exist both at national and county levels is if we can just support for simpler and fairer regulations that will ensure even the low-income communities actually have the opportunity to thrive, because at the end of the day, the benefit goes back to the child. And also, if we can embrace the data-driven planning to influence policy, more of having an evidence-based approach, and also childcare, more of a multi-sectoral approach in terms of co-designing and implementation. We know that a child below the school-going age, mostly they are supposed to undergo through the health department. We have the education because we need to check on the transitions and all that. We have the child protection issues and the social services. So you find like maybe if it's about issues about water, sanitation, hygiene, you need the water department and such, the public health. So you find like a multi-sectoral approach will really help to solve whatever we've experienced. And also if we can have childcare financing through adequate budget allocation. So if the county integrated development plans, and currently as we are looking at 2025, 2026, if we can have the annual development plans incorporate like some childcare funding to support this. If you look at, we have the pre-primary education, we have up to like when somebody, like the child from 4 years and above, you look at the elderly who are being supported with a monthly stipend. But in this case, when we say the first 1,000 days of a child are the most important, whereby brain development occurs at that age gap, then it means we need also, as the government and partners, to ensure like these early years are funded to ensure that this child that we are waiting to give bursaries in future, their well-being is catered for while they're still at a younger age. And also just to oversee coordination between the different levels of government, there is the national and the county. And also we just work towards creating a pathway of professionalizing the sector. So in this case, I know there is the caregiver curriculum that NITA is working on, but more of like, let's give supportive supervision so that at the end of the day, because we are saying when we offer quality and affordable childcare services, it will be good for the child because they reach the developmental milestone. It will be good for the caregiver, they'll run thriving business, and also it will be a benefit to know our children are safe, the mama is motivated. Do they even make the minimum wage that some people earn? Let's make it like it's a good business for somebody to venture in. And also the mamas, the parents, they'll go out for women economic activities, and it will empower them to even at a household level. And at this point, also welcome the papapreneurs, like as we've heard about the positive parenting programs, like inclusion of men into childcare giving. And thank you so much. And yeah, asante sana.
Thank you very much, Susan. Thank you very much. The excellent work that Kidogo Yes is doing with reaching the communities in low-income areas is commendable. I'm sure if there are questions from the participants, you'll be able to get them and respond to them later. Right now, we want to move on to the next presenter, who will equally summarize the way you have summarized, Susan. The next presenter is Samson Mburu Gitau. He is a curriculum developer, instructional designer, and trainer. He has over 10 years of expertise, and he coordinates sector training committees to enhance industry linkages for advancing skills development initiatives. Samson Mburu Gitau works with the NITA. He will be taking us through the next session, which is about professionalizing the child care workforce, and is focusing on the child caregiver curriculum version 3. So Samson, the floor is yours, and I'm sure as an experienced trainer, you'll be able to summarize your great points in the next few minutes. Samson, you can carry on. I hope you have unmuted, Samson, so that we can hear you. Okay. Samson seems to be having challenges getting to us. Therefore, we would like to move on to the next speaker as Samson organizes himself. The next speaker is Cindy Lidhimbi. She works with Nature First. She's the Kenya Programs Manager, and she'll be talking to us about empowering home-based childcare providers, ensuring quality and protection in early childhood development. Again, Cindy, we know you'll be able to summarize your work. Cindy, the floor is yours.
Thank you very much. And it's a pleasure to be on this webinar. Are you able to see me and hear me? My camera on. There we go. Okay, allow me to share my slides. Thank you very much. As has been said, my name is Cindy. I'm the program manager for Nurture First Kenya. Thank you to the ECD network for this invitation to speak and share about our work. And alongside my very distinguished colleagues from DSD, NITA, and Kidogo. It's hard to go almost last because so many great things have been said already. But I'll begin with a brief overview of Nurture First. And then I'll dive into the various ways in which we are working to support empowerment of providers with a focus on quality. So Nurture First is concerned exclusively with building and strengthening systems and structures that support quality improvement in the home-based childcare sector. And we're focused specifically on the age group of 0 to 3-year-old. We believe, and I think has been said already, home-based childcare is the most prevalent form of childcare, and one of my colleagues like to say it's the most organically scaled version of childcare that you can find. But despite its prevalence, it is largely unseen, unsupported in the community. So our main objective as Nurture First is to identify, test, and scale effective support programs for the home-based childcare sector. The idea for Nurture First was conceived in 2020, and we began work in Kenya in 2022. And I think one thing just to note upfront is that we really, and it goes to the topic of this webinar about empowerment, is that we really strive to center the voice of providers. And I will speak to that during this presentation. And the second thing is that how we like to think of childcare, and we believe that childcare is a public good. And that way we see that the workforce as a critical extension of a public workforce, and therefore also reframing the role of government from one of providing oversight and regulation to also providing the critical support services and continuous professional development that a workforce would be entitled to. Over on this slide, it just shows many of the reasons why home-based childcare is favored by low-income and middle-income communities around the world, including right here in Kenya. I think it's always useful to provide a working definition and some images and I think Susan has already shared this, some of these similar images, so I won't dwell here, but just for context, we see home-based childcare, the working definition, as a form of paid or unpaid parental or non-familial childcare of at least one child that takes place in the provider's home or dwelling, where they reside themselves. So I think getting into the meat of the presentation and speaking to the title of empowerment, we view empowerment not only as an outcome that we're striving towards, but also as an approach. And really as such, it really guides the way in which we work. It means that we don't assume what we know, that we know what providers want, but we actually went to ask what they want and how they need it. And so we invested heavily in data collection during this inception and design phase of this work. We're operating in 3 counties where we mapped roughly 5,400 providers in total. This is the estimated 25% of the population, to understand what empowerment really means to them. What are those needs and services that they need, and what are they aspiring to, and how do they want this to be delivered to them? Just to say that we will be publishing this data in accessible formats in Q4 of this year, to allow the entire system to be able to interact and engage with this data and use it to also inform their own programming. I think to take away, I think Susan has shared much of this in her presentation, but the one thing I want to draw your attention to is that there is a huge gap between what providers desire in terms of skills and training and access to support services, and then what they are aware of that exists. And this gap between desire and awareness is one thing that we aim to really address through our learning interventions. And so this was the first step, really understanding what providers need and how and what the sector needs, and how we can program together with local partners. And so that's exactly what we did. We worked together with about 6 community-based organizations and convened counting working groups in the 3 counties in which we operate to design 8 learning interventions that are really focused on improving in 3 main areas. That's increasing the sort of recognition of the sector, improving quality, and then enhancing affordability, both for the provider, who expressed as one of their biggest challenges is actually the cost, and the fact that they have to often dig into their own pockets to subsidize what parents are able to afford. So affordability is the 3rd bucket of our interventions. For this presentation, I'll just focus on the top 3. So first off, we saw from the previous slide that only 3% of providers are really aware of the trainings and the support services that exist to them, either from the government or from NGOs in the local community, despite several services that we know exist and have discovered through the extensive mapping that we did. Access to information is fundamental for empowerment outcomes, but yet it's very difficult for providers to come by information that's relevant and that's also contextually important for them and relevant in the communities. So one of the first things that we've been working towards is really trying to bridge that gap, to connect providers to support services at a local level, and also for service providers to understand and appreciate that there is demand amongst this subsector of home-based childcare that exists, that they can be filling. Our working hypothesis is that these services actually exist, and that we have seen that, and it's been alluded to in several discussions, that the question is about how to effectively deploy services. And so one of the first interventions that we're really working on is translating all the data that we have about services and providers and their needs, and putting this on a database, and having this database really managed at a very, very local level, so that resources can be allocated more effectively to providers who really need them. The other thing is that, you know, information is only as good as is only as good as how it is interpreted by the audience that you wish for it to reach. And so we're piloting various ways in which information can be provided and interpreted to the providers. For example, we're using community mentors in 2 of the counties we're operating, who actually actively go and update the database and link providers to specific services that are happening. We're also piloting digital methods through SMS and other platforms as well. The other intervention that I'll touch on now is around quality improvement. And we know that improving provider skills will lead to greater agency and well-being for the provider. And if providers have greater well-being, then we know that the children within their care are going to have greater well-being as well. And so this is one of the key areas for us, and why, and the approach that we're using to strengthen and to build the capacity of providers that we're working with. What we're doing is we're piloting a quality improvement roadmap that really centers the children's well-being, as well as the incentives and the starting point at which providers are. And we don't believe that these two are at odds with each other. Trying to pursue children's rights and children's needs, as well as those of the providers, are not at odds with each other. And so we've been working closely with the county government in Mombasa to develop to develop baseline, what we're calling minimum guidelines to guide quality improvement. The technical working group is also concerned with multi-sector coordination. And the first validation of these standards is actually ongoing as we speak, and it's a very live process. And we expect the county will coordinate the efforts, all the actors and the efforts of the partners within the landscape to pilot these in the forthcoming weeks. To meet these prescribed minimum standards, then we've had to develop this quality improvement roadmap, and we're very conscious that there are also several ongoing efforts to develop curriculum. I think one thing that we always try and do is see how we're adding value to the ecosystem, and really, I think one of the key areas is around how providers really like to learn, and how to best increase the access to important content and services like this. And so what we also did is, in the 3 counties, really look to understand how providers really want to learn. And that's what you see in the bottom right of the slide. So how often, where, and through what mediums, what happens to their children when they go for trainings, how long should the trainings be? And so that is also all informed the quality improvement design. What we then did is we reviewed local content and benchmarked against global standards, and then have designed this approach around this. The other thing is that this is also broken down into very clear categories along which a provider can really progress from these non-negotiables all the way up to ideal standards. This approach, again, also frames the government, reframes the role of the government as one that is concerned with providing capacity development and talking a lot more to the supportive supervision that's been mentioned already, in addition to oversight, which is also their role. I've spoken briefly to how the insights of providers and preferences have informed the delivery. And then the next step will be the review and iteration to inform capacity development programs. In the interest of time then, so far I've spoken about what we're doing at a very distinct provider level, building individual capacity development and connecting providers to support services. I think for scale, we really need to think about other touch points between the provider and the wider ecosystem, both family, the community level, and policy level, and of course not to lose sight of really what is the deepest motivator of all our actions, which is our beliefs and values. And that should also be is central to all of our work that we do as well. Towards this, we're working with the local community in each county. We can be, as mentioned earlier, we've convened county working groups and are building, through these working groups, building local champions for the home-based childcare sector, all working together on the hypothesis that I shared earlier, that we're working together to both extend the critical services that already exist and crowd in others. As more and more organizations, people we've spoken to about the private sector already, as more and more become aware of the needs and the opportunity to really create transformational impact, we expect to see more and more services get crowded in. And that's what we're doing around the community. As more and more families are engaged and understand to what's been addressed here or in this webinar already, as more and more parents are aware of their role in providing nurturing care as well. More and more they'll hold accountable and demand more from the services that exist for their children at the local level. And the next layer is working with the local government and county level. We're supporting providers to advocate for their own needs. And we're also working directly with the county. And this has been a really exciting part of our work as we see really government adoption. And as I said earlier, really the government reframing their role. We've really seen a lot of impact and in this area already. We've been providing technical assistance to review decision-making and policy and institutional frameworks to ensure providers are represented in decision-making organs that exist. And we've defined 4 sort of key policy asks. Chief amongst them is really defining what the various levels or various aspects to which childcare is delivered. We know we're aware of the childcare facilities, we're all aware of that, but there's also home-based childcare, there's center-based, there's childcare that's delivered privately in one's home, and that delineation really needs to be very clear to be able to guide implementers at a county level as well. And then lastly, at a national level, working with partners to advocate for clear definitions on childcare. And I think this is something that will support the entire sector, and we're working together with partners to do that. I think that is my last slide. Thank you very much, and I look forward to engagement during the Q&A.
Thank you very much, Cindy. Thank you. We will, in the interest of time, we want to, I'm sure there'll be questions for Cindy, so just note them down. We'll give you a chance to ask them so that Cindy can respond to them. Samson Mburu Gitao from NITA is now here. We would like him to lead us to the next session. The session is on professionalizing the childcare workforce, child caregiver curriculum, the 3rd version. As I had mentioned earlier, Samson Mburu Gitao is a curriculum developer, instructional designer, and trainer with over 10 years with NITA. He also coordinates the sector training committees on the skills development initiatives that NITA carries out. Samson, the floor is yours. We would like you to take us through those slides, and we would, in the interest of time, ask you to summarize. As an experienced trainer, I believe you should be able to summarize in as few minutes as possible, because there are a number of questions that people want to hear responses to, and we would like to give them a chance to do so. Samson? You need to unmute. Thank you.
Okay, good afternoon. My name is Samson Mburu, that is from NITA, Research and Curriculum Development. I'm here on behalf of the speaker who was supposed to be here, who is Phyllis Kiplagat, our manager. We are giving a presentation in regards to the professionalizing the childcare workforce, childcare caregiver curriculum 3. Maybe you can allow me to present my presentation, because I've tried to summarize it so that we can be a bit faster. Maybe let's continue. National Industrial Training Authority is a state agency under the Ministry of Labour, mainly established under the Industrial Training Act, Cap 237. We can proceed. Initially, NITA was an upgrade of former Directorate of Industrial Training. And we have our offices that is in an industrial area. And we have other offices in Mombasa, Kisumu, Eldoret, Nakuru, Kakamega, Nyeri, Thika, Embu, and at the river. Our mandate is to ensure adequate supply of properly trained manpower at all levels of industry, mainly to promote the high standards of operations. We are guided by the vision that the authority is transforming and enhancing competitive skills development for the industry in Kenya. Our mission is to enhance skills development, productivity, and employability through effective regulation of demand-driven training at all levels of industry. We are guided by those core areas, core values, which is we normally call it as KILA in terms of a shared prosperity, knowledge, all those. Maybe because of interest of time, we can be a bit faster. The functions of NITA is one, we are guided by the Section 3 of the Act, which includes industry training, regulations, and provision. We also have industry training levy administration. We also do what you call the regulation of registered industrial training providers, and at the same time integrating labor market information into skills development. We also do development and the harmonization of industrial training curricula, assessment guidelines, assessing industrial training and testing occupations, awarding certificates. We also do accrediting of institutions engaged in industrial training. Now the other one is we normally have what we call the sector training committees. These are committees which have been established under the Section 4J of Industrial Training Act. They are mainly supposed to perform functions of the board in relations to industrial training. We currently we are having 12 sector training committees which guides on matters of training, and their main reasons for initially they were 12, they were 9, but currently we have tried to reconstruct them into 12, mainly to support the implementation of industrial training programs. Then to restructure the STC to make them more responsive to the needs of NITA, align them to the priorities of the bottom-up transformative agenda of the government. These are the 12 sector training committees. And for us, the child care, it falls under sector number 4, if I'm not wrong, that is on energy. We can proceed. These are the first 3. This is a sector in finance. We have a sector in infrastructure, manufacturing. There's a, and then we have a sector in education, where childcare falls. We can proceed. Let's proceed. Let's proceed. These are the terms that are very crucial, especially for NITA. We terms like industrial training, which means training that is happening in the industry. Industry, for us, we normally describe it as a trade, occupation, profession, or an economic sector for which an STC has been established to, for purposes of training committee. Then let's continue to the next one. Now, early childhood development, ECD, falls under education training and allied agency sector. It's mainly, okay, fine. It's mainly to regulate the sector and professionalize ECD. NITA developed a curriculum in 2021. Let me give an overview of childcare landscape in Kenya. Kenya has a population that is made up of young population. This category is highly demanded to offer workforce, therefore need for childcare services. Similarly, childcare facilities lack proper training for caregivers, leading to varied quality in service delivery. And all those are the one that led to development of a training curriculum in 2021. We proceed. So what are the benefits of a professionalized workforce? Mainly, it's very important in terms of improving child outcomes. It's very important in enhancing trust from parents. At the same time, it's very important when it comes to higher job satisfaction among the caregivers. Those are the very important benefits. In 2022, a consortium that was led by AFCEN approached NITA, and in that manner, we went in a process of development of a curriculum for the child caregiver. This was meant to equip the caregivers with essential skills and knowledge. Let me take you through the content of the reviewed curriculum. We have the first, which is the introduction to the childcare, which is supposed to take 30 hours. We have occupation health and safety at home and care centers, which is supposed to take 60 hours. We have developmental milestones, 58, grooming the child, 57 hours. We have health and nutrition, 58 hours, habit training, child play, basic home care. And we also added what you call the communication skills. These are generic skills that are very important, especially when you are training these persons. Life skills, business, ICT, science, and basic mathematics. Our course duration is supposed to take 314 hours, and of which 79 hours shall be theoretical, while the 235 shall be practical training. We also advocate for attachment, which lasts for 199 hours. Remember very well that our training is competence-based. So that's the reason you'll find most of the trainings are practical-based. On the other hand, less of theory. Then we capped entry requirements at 18 years, and at the same time, completion of level 1 of the Kenya National Codification Framework, of which level 1 is a primary holder. Accreditation of training institutions. All industrial training centers offering childcare course shall be accredited as per the guidelines and the requirements of the course. And the accreditation shall be subject to confirmation of availability of specified workshops, tools, training, equipment, and material requirements as outlined in Annex 1 and 2 of the curriculum. In our curriculum, we have provided those requirements that one is supposed to meet for you to be accredited as an institution or a training provider. We have also requirements for assessment, which we have the assessment. One is a progressive assessment, which shall be administered and marked by the trainer upon completion of specified topics as outlined in the curriculum. At the same time, NITA shall be availed to marks shall be availed to NITA in the prescribed format as and when required. Then we have the assessment. Formative assessment shall be aggregated to constitute that % of the trainee's final award. Then we have trainees shall pass the progress assessment to be allowed to sit for the summative assessment. On the other side of the assessment, the summative assessment, we shall have, it shall be based on the expected performance outcomes as specified by the various topics. The trainee shall undertake at least one progress and one summative assessment. Again, the assessment shall comprise of practical and theory component. The practicals will account to 90%, while the theory will account to 10% of the assessment. And that is for level 2. Again, on the issues of assessment, at registration for assessment, summative assessment, candidates shall have successfully completed the required training. We proceed. And then other requirements include trainees are expected to attain at least 80% of attendance. And that's the end of our presentation.
Thank you very much, Samson Mburu, for that excellent summary of what and the excellent work that NITA is doing and the caregiver curriculum that you have developed. I want us to take questions. Hang on, Samson, because there is a question that participants have been asking, and this is a good time. We will only give you one question so that we can, in the interest of time. The question has been, how will NITA facilitate the onboarding of existing childcare facilities that have not yet been professionalized, their caregiving services. So is there a process in which those ones that are already doing this can be onboarded and therefore professionalize their caregiving services? Samson?
Okay, very good. For them to professionalize their services, one, they need to have registered as a training provider with NITA. Once they have registered as a training provider, we normally advocate that they be part of, they offer our training programs, which means they'll also have to register as an assessment center. And in that capacity, we'll also invite them to be trained as a TOT, so that they can familiarize themselves with our curriculum, that is a childcare curriculum. And NITA will be also performing regular monitoring and evaluation to see how the training is being conducted, at the same time how the assessment is conducted. We'll also do what you call technical support and various research through our curriculum development processes. So the team, we will do a lot when it comes to the onboarding of the, are we together?
Yeah, we are together.
Yes.
Thank you.
We'll do together when it comes to the onboarding of these facilities, because we don't want to leave them, especially when it comes to the implementation of our curriculum.
Thank you very much.
Yes.
Quick one for Cindy. I want to move on to Cindy. Quick one for Cindy. Cindy, you have mentioned the quality improvement standards, and you set out, there's a roadmap that you've mentioned that you are working on. Just to clarify, what are the quality improvement standards for home-based care facilities? I think it's ongoing work, but is it one or two things you can mention around that? It's a question that people are asking.
Yeah.
Cindy?
Yeah. Yes. Hi. I hope you can hear me. Yeah. So I believe the question is directed at childcare facilities broadly. But let me answer on what the work is ongoing at the county level. The county convened a technical working group looking at childcare standards, as well as multi-sector coordination. They previously had a number of standards that were applied to the home-based childcare sector, but were not really designed for the sector. They were designed for ECD facilities and other institutional childcare settings. So the technical working group was convened to relook at these standards and advise on revised standards that are specific to the home-based childcare sector, which is where we've been providing technical support there. And so there's what is coming out, I think we're at the first validation of these guidelines, really, is a series of very non-negotiable basic standards that are applied, that can be applied in the home-based childcare setting. But by virtue of the fact that really all children across, no matter where they're looked after, should be guaranteed some level of equity in the way in which childcare is delivered to them. We expect that some of these standards will also be applicable to, actually all of the minimum standards should be applicable in other settings, childcare settings as well. So it's a very live process, and it's really evolving. I think that there's one validation ongoing today. So this is something that's been convened by the Director of Public Health with the Department of Education in the county. So I expect that it's an area that we'll be able to share more on with the network to disseminate to its members, so that everybody can be involved in reviewing these standards and adding to them and strengthening them for the good of the entire sector.
Thank you. Thank you, Cindy. A quick one to Kidogo. You mentioned that you're in several counties. I hope that you're also in ASAL counties. The question is, what is being done to ensure that children in ASAL county areas also have access to quality care? Very brief answer in the interest of time.
Thank you. So I'll say the counties that we work in, that is under ASAL currently is Kajiado, part of Kajiado, and we previously worked in Turkana, that is Kakuma and Kalobei. But you find mostly in those areas, there is the partnership between private partners, the government and government stakeholders, more of looking at either mobile schools or some accelerated learning programs. And you find like in those cases, childcare may not just be childcare alone, but maybe even some children beyond the age of 5 still go into childcare centers. So maybe mobile schools, it works, and even things to do with the mobile, how do you call it? The mobile health stations that go round and round. And we have some feeding program supported partially by the government and partially by other non-state actors. So it's more of a collaborative approach between non-governmental organizations and the government. Yeah.
Thank you. Director, we will finish with you. You did a very good job setting out a policy framework that is existing, especially around positive parenting. The question is around child protection and whether these policies that you have, part of what you have very well articulated, whether they're being implemented fully. Where are we as far as implementation of policy is? Are we halfway? Are we, from your perspective, from where you sit, do you think we are fully implemented, or if not, how far are we? Director,
Okay, thank you very much. Currently, we have the existing child protection policy, and I think it stipulates on the implementation processes. You remember there is an issue of the institutionalization of children in the institutions. We are advocating for the care to be taken by the family, the parents and the family, and also we involve the community. When you look at in Kenya now, what protects the child as an individual? First, we have the Constitution of Kenya, that's the 2010. We have the national policy for children, and now we also developed the national policy, family promotion and protection policy, which was done last year. And it is through these policies that we have come up with this positive national positive parenting program.
Mm-hmm. Thank you.
Then within the same state department, we have also developed the national policy for rehabilitation of street families, which was done this year. We have the national policy for social protection, which usually entails on the care of vulnerable groups of the society, where children are also included. We have the education policy, the Children Act of 2022, and currently we also have the care reform strategy.
Thank you. Thank you, Director. Thank you, Director.
I'm not getting you. I don't know. Maybe it is where I am, where there is a problem.
So I was saying, thank you very much, Director, for that contribution. I will now want to ask Abella, who has raised her hand. I just give you half a minute. Please kindly ask your question. Half a minute, and then we will have a response. And I will ask the director, executive director of ECD Network, to take up that question you are about to raise, or if any of the panelists can do so. And then director will close for us and we'll be done. Abella? Abella, I've seen your hand.
Thank you, Manaweza. I think most of my questions have been addressed with the team that on this call. So I think we just leave it at that. Thank you.
Thank you very much. Executive Director? I've seen Dr. Teresa Moma in the house. If you can close for us, that would be excellent. We thank for every member for their patience so far, for staying with us over the past 1 hour and almost a half. We have had a very exciting conversations, very exciting input from our 4 panelists talking about positive parenting, about local communities and social franchising solutions that are being done at that level, talking about quality improvement and empowering childcare providers. and talking about how we can professionalize this childcare workforce with a curriculum that responds to the needs at that level. And we are so glad that you've been able to do this. And if the director can close for us, that would be okay. Director, if you're around. Okay, and then I just say thank you very much, everyone, for having participated in this webinar and your patience to have been with us all this time. If there are questions that we've not responded to, we will endeavor to get back to you. We had limited time and therefore couldn't respond to all the questions, but nonetheless, all those questions that you raised, we have a record of them, we have responses to them, and we will get back to you. Otherwise, good afternoon. Thank you very much for your patience, and God bless you. Thank you.
God bless you too.